The Alabama Department of Mental Health is laying off more than 580 workers. The announcement came earlier today. Fox News reporter Andrew Perez tells you more.
Seems the state's financial woes are even hitting the Department of Mental Health. The department announced Friday that it is laying off nearly 600 employees statewide. Turk Sletzinger, the CEO of AltaPoint Health Systems in Mobile, says the department had tough decisions to make, but it made them carefully.
It's a tragic thing that they do get laid off, but the reality of it is that most of the patients that have been served in the state institutions for many, many years have been passed and outsourced to the community. We are an example of one of the community mental health providers that actually is a recipient of some of those patients.
Commissioner Ball with the Alabama Department of Mental Health said the recently passed budget left the department with a $30 million shortfall for 2012. The commissioner says with tough management decisions, the state has been able to reduce that deficit to about $14 million. Commissioner Ball released a statement saying, "Regrettably, a reduction in the workforce will be required. However, our first priority is to the individuals this department serves." Now, officials say most of these cuts are going to come from Tuscaloosa's Partlow Development Center, which was already going to close down later this year. But another hospital affected is Searcy Hospital, which is in Mount Vernon.
Searcy Hospital is a state institution that we will admit patients to if we can't stabilize them in the community.
But it's Tuscaloosa's Partlow that will see 400 of the 582 layoffs. The remaining 182 cuts will be spread across state hospitals.
Although it sounded like a huge number, when it comes to the amount that were laid off at each one of the individual psychiatric hospitals, it's not that large.
Reporting in Mobile, Andrew Perez, Fox 10 News.
While the state says the cutbacks went into effect July 1st, the next round of cuts are expected in October, followed by a third round on November 1st. We're told the cuts should not affect patients.